Hi, my name is Dr. Brian Glatt. I'm a board-certified plastic surgeon. I practice in Morristown, New Jersey at the Premier Plastic Surgery Center of New Jersey. I'm originally from Livingston, New Jersey. However, I spent the majority of my training in Philadelphia, where I went to the University of Pennsylvania for college, medical school, as well as my surgical training in surgery and plastic surgery. I then spent a year of specialized training at Memorial Sloan Kettering Cancer Center, focusing on complex reconstructive techniques, and wound up after training in Morristown, where I practice currently. So my approach to the abdominoplasty patient is similar to my approach to all of my patients, which is I do a very individualized approach. Every single person I see is very different from the next. People have different needs and their body types are very different. And I respond to that and I alter my surgery based on that. So where there is a variety of techniques that are standard in doing an abdominoplasty, I alter everything I do depending on who I'm working on and what their particular needs are. And I think that's the nature of why I'm able to achieve the results that I do. It's not doing a cookie cutter thing and doing the same thing on everyone, but changing things around based on who exactly is in front of me. In other words, if someone's a great candidate for surgery physically, they may not quite be ready for surgery, for instance, if they have very young children that still require a lot of lifting or a lot of help at home. In other words, everything needs to be in place for you to have an outstanding result. It's not just the surgery I do, it's not just the anatomy of the patient I'm working on, it's everything else that needs to happen in order to determine that your recovery is going to be okay, you're going to have a good social support system during recovery, and then it's my part to take care of things physically and technically, provide you with a good result. And it's your part to stay healthy and to heal and do well. I want someone to feel important when they come to my office. They need to feel they're being taken care of and they need to feel that their time is important and that they're going to have an outstanding experience. I'm in a position where people do have to wait to have an appointment with me, and that means a lot to me and I don't take that for granted. So someone's waiting to have a consultation with me. When they show up, I give them my full attention. Not only do I like to provide a completely individualized approach to each patient, but I provide totality of care. So I'm available for someone all the time. I explain that I'm the only one who does the surgery. There's no students, no helpers. There's no one I'm training when I do the surgery. I see you at all of your visits afterwards, and I typically provide my cell phone to my patients afterwards. They can reach me at any time, although most of them don't need it.